All right, we're going to dive into a pretty big idea today. The thought that all those small, everyday choices we make, they don't just affect us. They actually set off a domino effect that shapes health and even mortality on a global scale. So let's see just how deep this connection really goes. I want you to think about that for a second. Your daily routine, my daily routine. What if all those little habits are directly connected to the biggest health challenges we face as a planet? It's a connection that goes way, way deeper than just a New Year's resolution. So, why does this matter so much? Well, according to the World Health Organization, here's why. A staggering 60%, that's more than half of all deaths around the globe, can be traced right back to our daily behaviors. I mean, that number is so huge, it's impossible to ignore. And it really goes to show we have a lot more influence over our health than we might think. Okay, so to really get a handle on our role here, we first need to understand where our power begins and where it ends. Let's draw a really clear line between the health risks that are totally out of our hands and the ones that are firmly within our control. So on one side, you've got the non-modifiable risks. Things like our age, our genetics, our family history. We can't change the cards we were dealt there. But on the other side are the modifiable risks, and this is where we actually get to play our hand. Things like our diet, how active we are, whether we use tobacco, these are the choices where our influence is absolutely enormous. And all this brings us to a really core concept: behavioral risk factors. It's basically the official term for any action or habit that we can change, which in turn impacts our risk of getting sick. The most important part of that definition? These aren't our destiny. They are patterns we actually have the power to change. So what exactly are we talking about here? Public health organizations have done the work and have pinpointed the behaviors that have the biggest impact on our health. So let's do a quick run through of the 10 most common ones. Now, a lot of these are probably going to sound pretty familiar. You've got the well-known heavy hitters, right? Tobacco use, harmful alcohol consumption. Then you've got two sides of the same coin: eating an unhealthy diet and living a sedentary lifestyle. And rounding out this first group, unsafe sexual behaviors, which, of course, carry their own very distinct health risks. But the list doesn't stop there. It also includes factors we might kind of overlook sometimes. Things like drug misuse, of course, but also something like chronic sleep deprivation or unmanaged stress. And finally, it covers how we engage with our own healthcare, like not following a doctor's advice or skipping those really crucial preventative checkups. And this is where we really connect the dots. See, these behaviors aren't just abstract risks. They have very direct, very real consequences. An unhealthy diet is a direct pathway to things like diabetes and heart disease. We know that tobacco use leads to lung cancer and stroke. The cause and effect relationship here is real, it can be severe, and honestly, it's often predictable. So we've seen the personal risks, but here's the thing: the impact of these choices doesn't just stop with the individual. They create a ripple effect that's felt across the entire globe. And that ripple effect is massive. These behaviors don't just lead to higher mortality rates. They put a huge strain on entire healthcare systems with preventable costs. They make health inequality even worse. And they can even make a person more vulnerable during outbreaks, something we all saw with COVID-19 and underlying conditions. This quote just nails a really critical point about fairness. The ability to make healthy choices isn't the same for everybody. I mean, if you don't have access to healthy food, or safe parks, or good healthcare, it's just so much harder to avoid these risks. This isn't just about individual willpower, it's really a matter of social and economic justice. Okay, so we've established the problem. It's big. But the good news is, because these risks are behavioral, they can be changed. So let's shift gears and focus on the solutions, both for ourselves and for our communities. When it comes to individual change, one of the most effective tools out there is the SMART Goals framework. It's designed to take a vague wish and turn it into a concrete plan. By making a goal specific, measurable, achievable, relevant, and time-bound, you're basically creating a clear roadmap for your brain to follow, which dramatically increases your chances of actually succeeding. Here's a perfect example of what I mean. I will exercise more well, it's a wish, right? But I will walk for 30 minutes 3 times this week is a plan. You know exactly what to do, how to measure it, and you'll know if you did it or not. It's just so much clearer, it's achievable, and it's far more likely to stick. But individual effort is only half the story. Real, lasting change requires a much broader public health approach. Think of it like creating an environment where the healthy choice becomes the easy choice. That happens through smart policies like tobacco taxes, clear education like nutrition labels, and building things like bike lanes. It's all about society creating a support system for health. So, we've covered the risks, the global impact, and the strategies for change. Now, it's time to bring it all back home. Because every massive transformation, every big story starts with one small personal step. So I'll just leave you with this question. It doesn't have to be some monumental life overhaul. It could be as simple as taking the stairs, or adding one vegetable to your plate, or setting a consistent bedtime. What's one small, achievable step you can take today to start rewriting your health story? The power and the choice is all yours.